this barrier is not sterile, it's just clean, but I'm going to use it as a field to set up my sterile supplies. And I'm going to set them up in the order I'm going to use them to keep from reaching over. So what I use last, I'm going to put down here. So I think about this in the reverse order. So the last thing I'm going to need is tape to tape it down. And if you drop something on the floor at this point like I did, we have to get new stuff. So I've gone and got new stuff. Now I'm going to open these, and when you're opening these packets, you have to be very, very careful that you don't contaminate, because you have a very small sterile field on the inside of here. So when you open very gently, and you're going to place these on your field. Now these need to stay open, and they don't need to flop outside that field, because each one of these is an individual sterile field. Okay, so I'm going to put my ABD on last, so I've got that there. The next thing that I'm probably going to need is my drain sponge, because that went on after the gauze. So you can kind of work these loose. Remember, you have about a 1 inch, but on these there's not really quite an inch, so the area around it is sterile. Open them carefully, place them in the order that you're going to use them, make sure they stay open. So the next thing I'm going to need is going to be the covering for the incision itself, which is my 4x4s, and something to make that fluff out of. So I'm going to open these, and again, same thing. I'm just putting these in the order that I'm using them. If you were to flip something outside that field, make sure you get an extra. So sometimes it's good if you put extra things in your pocket, especially when you're new at this, because you'll open something and flip it outside your field. For your check-off, if you do that, just simply let us know that you contaminated, so we'll know that you recognize that you broke sterile technique. And I can open these sterile gloves, and I don't need this outside packet because this inside packet is sterile. So I can actually get rid of this in the trash instead of the red bags. So I'm just going to go ahead and lay that down there. And then my sterile gloves, so I'm going to put my gloves on. I'm going to clean with these. This is my dressing cover, this is my drain cover, and this is the outside cover. So this is how your table should look when you're setting it up. If you're left-handed, you're simply going to have to reverse that. Okay, so I cannot technically turn my back, but you know where your saline is. I need this saline. When I'm opening this saline, it's brand new. I'm going to take my pen. I'm going to label it, write on it, and put today's date and what time I opened it. And then I'm going to open my saline. And when you do this, this lid goes up like this on your table, because you don't want to contaminate the inside of that. Get this off of here. And we always lip the bottle, and by lipping it, I'm going to pour just a little bit out in case there's some bacteria around the edges of it. So by lipping it, we're going to pour just a little bit off, and I'm not going to do this because I don't want to get everything wet. We're going to lip it. When you lip it, always palm the label. So label goes to my palm, I lip it, and now I'm ready to pour my saline into this. So I'm going to pour my saline into here, so these are going to be wet. And technically, I'm done with that, so I can really go ahead and put my lid back on. Okay, so I'm done with my saline. These are wet. I'm ready for my dressing. The other thing I need to do while I'm doing this is I need to inspect my incision. I looked at my dressing, but my incision looks like it's well approximated because the edges are together. There are staples intact. There's 1, 2, 3, 4, 5, 6 staples that are in there. There's a Penrose drain to the patient's left of the incision. So when I'm cleaning this, what I'm going to want to do is I want to clean the incision first because it's the cleanest part. I want to clean the side away from the drain because the drain is considered dirty. I want to clean the side next to the drain. Then I want to clean around the drain, and I will do this starting at the incision and pushing things away from it because I want all that debris away from my incision. So now I need to put on my sterile gloves so I can touch everything in my field. And this is a tricky part sometimes. You got to get stuff out of your way to give yourself plenty of room. Still, I can see everything. I know nothing's contaminated me. So when you put your sterile gloves on, and we'll practice this part you should have down before you even start. So make sure you know how to put sterile gloves on. hold your thumb up. This will help you from contaminating everything. And I always pull it down to where my fingertips are touching, so that way my fingertips aren't flopping around. So now I'm going to clean the wound. So these are already wet with sterile normal saline. So the first thing I'm going to do is go down the wound itself because it's the cleanest. Then I'll discard that. Make sure you don't touch your hand to the bag or anything because my gloves are sterile. Okay, take another one, go down the side away from the drain. Then take another one, go down the side toward the drain and just kind of push that drain. Try not to touch it with your glove. And then I'm going to clean around the drain, and the way you clean around the drain is you're going to start kind of at this incision here, and we're going to go in a C-shaped outward. And these are getting kind of full, and sometimes that happens. My bag was a little bit small. So I'm going to start here and do the second one, C-shaped away. And so now I've got my wound cleaned, I've described it, everything's good. I can now touch the wound because that's another thing I need to do. My gloves are sterile, the wound is technically sterile. Okay, it's not very tender, I don't see a whole lot of debris coming out, it really is in place, and you want to feel for heat, is it warm to the touch? So now I can redress it. So he didn't have a whole lot of drainage, so I'm not going to put a huge dressing back on. I think I'm just going to use one of these for this. That covers that up real nice and pretty. I'm going to go ahead and do my drain sponge. When you're putting your drain sponge on, remember that the drain is going to ooze out a lot of stuff. So I want this to collect everything that comes out. If the patient's laying in bed a lot, I would turn it this way because this side is the most absorbent. If you turn it that way where the crack is, then the stuff's going to leak out. If he's up ambulating a lot, I would turn it this way. So let's say Mr. Smith is going to be laying in bed. So I'm going to turn my drain sponge this way. So that way, when the drainage runs out, it's going to collect it on that side. Now the next thing I'm going to do is make a fluff to put over that drain. And if I fluff this up, it has a lot more surface area. So therefore, it's going to absorb like all of that drainage a lot better, and it'll kind of wick it all away from the wound. So I just simply sit that on top of that drain right there. And everything that comes out will just kind of suck it away. The next thing I have is my abdominal pad, which is my cover for it. You notice it'll have a blue line on it, and then the other side. Blue line, blue to air, so I put blue to the sky, so blue goes on top. And for him, you kind of have to decide which way your dressing is going to fit best. For him, mine looks like it's going to fit real well this way, so I'm simply going to sit this down on there. Once I have that covered, the sterile part of the procedure is over. So I can now take these gloves off, and I can tape his dressing. And so today's date, what time I changed it, and my initials. Okay, so that's on my first piece of tape. I'm going to measure this. I want about an inch or so hanging off on each side. And if you really like your patient, go ahead and fold these corners down just a little bit like that, so that way it's easier for the next person to get the tape loose. So when I put this on here, I always tape in the center first. So I'm going to push here and then just kind of press outward. Okay, so that's your first piece of tape. Never do a window pane around it because it can't get air underneath it. Never tape like several pieces of tape around the edges. And for an abdominal wound, since he's going to be bending this direction, you always want your tape to run this direction. The same thing over a joint, and we'll kind of talk about that in class. So even if I turned my ABD this way, I would still tape crossways. That confuses a few folks. So notice I'm still folding down the edges. I'm going to put another piece on top here just to hold this in place real well. Another piece on the bottom. Okay, so now my dressing is complete, so I'm ready to tear down my field. Mr. Smith, are you still doing okay? Are you still comfortable? Take this blanket with us. ahead and put your rail up, put your bed down. Okay, so here's my red bag trash. I have a nice little red bag. This goes into my red bag waste as I leave. You can tape that or you can tie it however you want to do it. I usually just tie mine off because that's my red bag. Everything else on this table, I'm going to take my tape with me, and or you can set this in the patient's room. Remember, I've labeled it. I'm going to set it on this table. My pens go with me. All the rest of this is trash that goes in the trash can. Put his bedside table back in place. Make sure his call light is still in reach. Take your blanket with you. Grab you some hand sanitizer on the way out of the room. Make sure you clean your hands. Mr. Smith, is there anything else I can get you? I'll be back to check on you.